Good morning and welcome to the City of Toronto's COVID-19 media briefing for Tuesday, January the 18th, 2022. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and Incident Commander for the COVID-19 response, Matthew Pegg. Mayor Tory?
Well, good morning and thank you, Brad. The City of Toronto is continuing the cleanup work from the major winter storm we experienced yesterday. Work is ongoing 24 hours a day until the job is done. 600 road plows, 200 salt trucks, 360 sidewalk plows are out, and people can see the progress being made and check their streets at the plow.to map, plow.to map, which can be found at toronto.ca/plowto. The city has completed multiple rounds of plowing and salting overnight on expressways, major roads, and is starting to tackle local roads. Across the entire road network, the city has completed a combined 11 rounds of plowing on expressways and 14 rounds on major roads. And plowing is continuing on local roads as well. Crews continue to clear the snow from all public sidewalks, bus stops, pedestrian crossovers, bike lanes, and multi-use trails. My latest update from the transportation staff confirmed that every road is being serviced again today. And the goal is to have a second round of plowing done on local roads today. Crews are experiencing challenges due to abandoned or parked cars. All staff and plows are out today and on the job, and we will continue to provide updates as plowing continues. As we announced yesterday, we will be deploying snow removal teams, something we only do in exceptional snow circumstances, starting with major roads once plowing operations have been substantially completed. To help with the snow removal operations, the city did declare a major snowstorm condition. Snow clearing and plowing operations have been continuous, and snow removal will be underway as soon as it can be. This was a big storm with a large amount of snow, a big storm in historical context, so it is going to take a big cleanup effort, and that's going to take some time, but the cleanup is well underway. I want to thank residents for their patience, and I want to thank our crews as well, but I want to thank the residents in particular for their patience as this job gets done and all the work that was done by all the people who have been working 24 hours a day. I would ask Torontonians for their continued cooperation in following the stricter parking rules during the snow storm condition, and I would also request the cooperation of City of Toronto residents in staying off the roads as much as possible and being considerate with the location of their cars on the streets. Our efforts to help residents get vaccinated against COVID-19 are also continuing nonstop. Team Toronto has now administered third doses of COVID-19 vaccine to more than 1.2 million people. This exciting milestone comes exactly 1 year to the day after we opened the first City of Toronto-operated proof-of-concept vaccination clinic on January the 18th, 2021, 1 year ago. Just a year from that opening, Team Toronto has now administered a first dose of COVID-19 vaccine to 89.9% of eligible Torontonians aged 12 and older, with 87% having received 2 doses. Following a service suspension due to yesterday's winter storm, city-operated vaccination clinics are back to normal operations today, with more than 5,000 booked appointments to be vaccinated at the 5 city-run clinics alone during the day today. As schools across the city return to in-class learning, likely tomorrow, after a couple of unanticipated snow days, our work to support the schools reopening and help kids get vaccinated will continue as well. More than 133,000 doses have been administered to residents between the ages of 5 and 11, thanks to our plan. In less than 2 months, approximately 51% of Toronto residents in this age group have received at least 1 dose, and 14% of kids have 2 doses. Toronto Public Health is continuing to work with healthcare partners and school boards to provide as many vaccination opportunities as possible for residents 5 to 11 years old and their families across the city, but with a special emphasis on areas that show under-vaccination rates that we are monitoring each and every day. Hundreds of school-based clinics have been held to help kids and families get vaccinated, and that work will be increasing over the coming weeks to support the province and school boards as they work to keep in-class learning on track. There are approximately 42 school-based clinics scheduled for the next few weeks as Toronto Public Health continues to increase its capacity to provide vaccinations for this age group. The City of Toronto and Toronto Public Health continue to work closely with the Toronto District School Board and the Toronto Catholic District School Board to arrange for additional school-based clinics in neighborhoods where vaccination uptake has been lower. Our VaxTO team has worked with the school boards so that they can reach out directly to families and the school community to share information about upcoming clinics. It's another example of how we are working well together, in this case with the school boards, to help people get vaccinated and to help us all to get through this pandemic and, of course, to keep the schools open safely. Our VaxTO campaign is also continuing to help parents and caregivers of 5 to 11-year-olds get information about vaccinations through telephone town halls. In partnership with the Hospital for Sick Children, the city hosted 2 virtual town halls in December, and more than 101,000 residents tuned in to the town halls with medical professionals from Toronto Public Health and Sick Kids. In addition, more than 400,000 phone calls were made to residents, connecting them to vaccination and booking information. Public health nurses also provided approximately 143 vaccine promotion sessions for parents and guardians of students between the ages of 5 and 11 years of age prior to the increase in cases due to the Omicron variant. This morning, appointments opened up for Team Toronto's next mega vaccination event, Vax the Northwest, coming up this weekend. The clinic will take place at York University's state-of-the-art tennis facility, the Aviva Centre, this Sunday from 11 a.m. until 7 p.m. The appointments went live in the provincial booking system at 8 o'clock this morning, and the team tells me they're encouraged by the additional booking numbers, and that's for a clinic taking place, Vax the Northwest, at York University this Sunday from 11 a.m. to 7 p.m. The Vax the Northwest Clinic is being held at the university campus, specifically to be easily accessible to adjacent neighborhoods with lower vaccination rates. Team Toronto is doing everything that it possibly can to reach these Northwest Toronto communities. Community Health Centre partners, Unison, Black Creek, vaccine engagement teams, the ambassadors, the Humber Hospital team, all of these people are combining together, including being on the ground in these neighborhoods promoting this clinic. The city's VaxTO program will be connecting by text with 8,000 Northwest Toronto residents over the age of 50 who are due for their 3rd dose and who are living in areas with low 3rd dose coverage. VaxTO will also be sending out broadcast voice messages with general clinic information to 30,000 people living in the area of the VaxTO clinic, which once again is at York University this Sunday from 11 a.m. until 7 p.m. There are more than 1,000 appointments available with capacity to scale up clinic operations. The TTC has been very helpful to us in putting on this VaxTO event in the Northwest. It is providing dedicated buses to help people travel from community hubs to the clinic at York University. There will be community ambassadors on the buses and at the clinic to help guide people through their vaccination experience. This is something that has worked well for us across the city as we've gone through 1st, 2nd, and 3rd doses, and as we've had the vaccination for kids program. Information has also been distributed in the community in Arabic, Farsi, Italian, Russian, Spanish, Tagalog, and Vietnamese, 7 of the languages most widely spoken in Northwest Toronto. At the clinic, interpreters speaking these key languages and others will be available, with additional translation capacity available by phone. And of course, as always, people are welcome to bring a support person to help with translation or any other needs at the time of visiting this vaccination clinic. If you or someone you love or someone you know lives in the northwest part of the city and needs a 1st, 2nd, or 3rd dose of COVID-19 vaccine, I urge you to book an appointment or help them to book an appointment at the Vax the Northwest Clinic, which again is being held at York University at the Aviva Centre on Sunday between the hours of 11 in the morning and 7 at night. The clinic is in your community, offering you and your friends the opportunity to help keep our city safe. And I want to extend particular thanks to our healthcare partners, to the people that are helping us put this on, to all of our ambassadors, and as well to Councillor Joe Cressy and to Commander Wiancek and the team, because all of them have been instrumental in putting this latest event together. We're also working to help support child care centres. I'm pleased to announce that the city has partnered with the province to help mitigate the spread of the Omicron variant by distributing rapid antigen tests within the child care system. Beginning today, community child care providers will be picking up 2 rapid antigen test kits for each child enrolled in their programs, as well as for each child care worker, as well as for the providers themselves. The use of these tests, in conjunction with the daily screening process that families and workers do every day before attending a child care program, will help to limit the spread of COVID-19 in these community child care centers. The city supports any effort to keep children, their families, and child care workers healthy and to minimize exposure to the COVID-19 virus. I want to thank the province for helping to support our efforts through this wave of the pandemic by providing these testing kits. Now, this seems a long way off from the beginning of my remarks today and from the events of yesterday, but I think it is so important to our forthcoming economic recovery and to getting ourselves back to being stronger than ever that I should mention something else that is very important that is happening today, which is the opening of registration for the Café TO curb lane patios. This should get people thinking of spring at a time when we desperately need to think about spring and happy occasions like sitting on a Café TO curb lane patio. Restaurant and bar operators who are interested in expanding their outdoor dining space into the curb lane and onto sidewalks can register and apply for permits online at toronto.ca/cafeto. Now in its 3rd year, Café TO is a program that provides hundreds of restaurant and bar operators in Toronto with the opportunity to expand their outdoor dining space through sidewalk cafes and curb lane cafes, infusing vibrancy along Toronto streets and in neighborhoods. As I said earlier on in analyzing the impact of the program, it also changed the look and the feel of the city for the better, as well as serving a vital economic need for some of our restaurateurs. In 2021, Café TO supported 1,213 restaurants with curb lane cafes, a total of 12 kilometers of new patios across the city. This year, Café TO operators are eligible for a matching grant of up to $7,500 to cover 50% of the cost of eligible property or site improvements related to curb lane cafe installations, sidewalk cafes, or patios on private property through the Café TO Property Improvement Program. I'm proud to have championed this pandemic program and to have led City Council in making it a permanent program for the city last fall. It has changed the quality of life in the city for the better and will continue to do so going forward. Again this year, Council has waived all application, transfer, and permit fees to make it as easy as possible for people who have been struggling to get back on their feet and to take advantage of this program. There is a new streamlined and online permit application process, and businesses will only need to apply once for year-round expanded sidewalk cafes. Businesses can submit application documents and complete payment in one convenient online system. Approved Café TO curb lane locations will be installed in time for the May long weekend, but I will be pushing, as was the case last year, weather permitting, for that work to start even earlier if that's possible. Café TO also supports restaurant and bar operators to expand outdoor dining opportunities on private property, and this has been particularly relevant to our friends that live outside of the downtown core. The city has enacted temporary bylaws to permit larger outdoor patios than would otherwise be permitted and to ease some other restrictions, recognizing in particular the economic benefits at a time when we're trying to get the city to be recovered as strongly as possible and stronger than ever. City staff have worked closely with the Toronto Association of Business Improvement Areas and local restaurant and bar operators, as well as accessibility stakeholders and others, to continually improve the Café TO program. I know this program helps restaurants and bars, and I know that they need that help now more than ever. And so I want to take this opportunity to encourage people to order takeout and delivery from restaurants right now, long before we get the Café TO up and running for another year. You can help now by continuing to shop local, take out local, eat local, and support these restaurants that are struggling. And I look forward to seeing Café TO up and running again this spring. In conclusion, I hope that today's update, while it's covered a number of different subjects, has provided a comprehensive update on our ongoing work, yes, first and foremost to help people get vaccinated, especially our kids, our ongoing work to support schools and child care centers to make sure they can remain open safely, our ongoing work to clean up from the major winter storm, and the ongoing work to support our restaurants and prepare for a spring and summer that we hope will be much more vibrant and will be part of that recovery that is going to see us become stronger than ever. We will get through this pandemic. We know that spring always follows winter, which means we will get through cleaning up from and dealing with this storm and with winter generally, and we will come back stronger than ever thanks to all this work. And again, I want to extend my particular thanks to all of the people who served us as a community yesterday, ranging from transit operators to first responders to people operating snowplows to transportation services people. There are many, many, many people that have helped to deal with something that was an event that's not entirely unexpected, but this was an unusually big storm for our city, and I think that we are in the process now of making sure that we can come back stronger than ever from that if we get the work done that I've described to you this morning. On that note, I will ask Dr. Davila to offer her update for today.
Thank you, Mayor Tory, and good morning. Today, I want to provide a situational update in relation to COVID-19 and the Omicron variant. With schools poised to return to in-person learning, and with new questions about what's next, I want to describe what we know and what we may anticipate in the coming days and weeks ahead. Currently, we continue to see a high level of COVID-19 spread in Toronto. I regret to report that since last week, hospitalizations, ICU admissions, and deaths due to COVID-19 have continued to increase. To those who are ill, I send best wishes for a speedy recovery. And for those who've lost loved ones, I offer my sincere condolences. In recent days, we've heard questions about whether the Omicron wave has reached its peak. While it is still too early to know for sure, we are seeing initial indicators that the rate of infection may have plateaued or started to decline. But we still have a long ways to go. The level of viral activity in our community continues to be concerning and continues to put a significant strain on our healthcare system. First, the level of admissions to hospital strains the resources within our hospitals. Second, with such widespread transmission in the community, healthcare staff themselves are falling ill because of the virus. This being said, while we continue to see widespread transmission of COVID-19, the most recent data show that there are reasons for cautious optimism. A recent summary of our hospitalized cases confirmed that we are seeing shorter lengths of hospital stay than in previous waves. Toronto's high vaccination rate is also having a significant impact in this wave of COVID-19 infection compared to previous waves, and 3 doses of vaccine continues to provide the best protection against the Omicron variant. Recent Ontario data paint a clear picture of the protection that the COVID-19 vaccines provide. For cases reported between December 24th and January 6th in the province, the rate of hospitalization for COVID-19 was 4 times higher for unvaccinated individuals than for those with 3 doses. The difference was even starker for the recorded rate of ICU admission, which was 8 times higher for unvaccinated individuals than for those with 3 doses of vaccine. So what does this mean for us in Toronto? Well, schools returning to in-person learning is a positive sign, as this is an essential activity that impacts the health and well-being of our children and youth. While reopening to schools to in-person learning and any changes to the current public health restrictions currently in place are within the power of the province, I would say this. We all have tools to preserve and protect the progress we're making and to help reduce the spread of the Omicron variant as much as possible. Using these tools will help to keep our school environments as safe as possible. The evidence shows that multiple layers of protection are necessary to mitigate transmission of COVID-19 and to keep schools as safe as possible. This includes vaccination, ventilation, filtration, daily COVID-19 screening for students and staff, using a well-fitting mask and physical distancing, amongst other measures. The science also suggests that increasing opportunities for people to interact with each other should be done with caution, especially as schools are just reopening. Ensuring the success of in-person learning for the rest of the school year relies on seeing solid evidence of an improving COVID-19 situation overall before introducing changes that are likely to lead to more in-person interaction. We've learned from our own experiences and from the experiences of other jurisdictions that going too quickly risks the progress that we have made, and in some cases has forced us to go back to more restrictions. We have seen and felt just how disruptive this is. Moving gradually allows time to assess the impact of changes that increase overall community activity and allows us to make informed decisions on next steps to stay in better control and protect the gains that we have made. I can compare this to the role of a physician when changing a patient's medications. If there's a change in a person's health and they are currently taking medications, doctors will slowly and methodically make adjustments and then evaluate the outcome. This is especially true with patients who are taking several different medications. There is a fine balance to maintain, with one change being made at a time, followed by a period of evaluation. A similar approach can be adopted as we think about our road ahead in the context of Omicron and public health measures. We are all looking forward to resuming activities that we have missed, and we need to do so slowly and with caution to protect the gains that we have made. A period of evaluation helps to ensure that the current combination of measures within our current context is effective. And as individuals, we each have a role to play as well. We must continue to do our very best to protect and care for ourselves and others by taking the steps that we know work. Getting vaccinated, reducing in-person contact, wearing a well-fitting, high-quality mask, practicing physical distancing, and staying home when we're sick. As the mayor just said, I know we all want to see the end of this pandemic. And while that day will come, until then, we must continue to do everything within our power to stay the course. I'll now turn it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. Davila. Good morning. Before I provide my update today, I would also like to acknowledge that it was 1 year ago today that we opened the very first proof of concept COVID-19 vaccine clinic at the Metro Toronto Convention Centre. More than 2 months ahead of schedule, our COVID-19 Immunization Task Force opened this clinic to coincide with the very first available vaccines provided to us by the Province of Ontario. In opening and operating this initial proof of concept clinic, our team was also able to validate and finalize the COVID-19 Mass Immunization Clinic Playbook, which subsequently informed and enabled the setup and operation of COVID-19 vaccine clinics across the province. I would like to acknowledge and thank everyone who has been a part of this incredible effort, including our dedicated Team Toronto Vaccine Partner Network. What has been achieved through your hard and continuing work has literally been life-saving, and I thank you all. I would also like to thank everyone who worked so hard to manage and respond to the winter storm yesterday, as well as the ongoing snow clearing and cleanup operations. This is another example of Toronto's ability to respond to changing and demanding circumstances as they happen. Yesterday, we witnessed people helping one another and coming together to help those in need. Thank you for your continued patience and your never-ending willingness to help when it matters the most. As the snow clearing operations continue, each of our emergency services are directly connected with Transportation Services Road Operations Managers via the Emergency Operations Center. This will ensure that our responding emergency services have direct and timely access to snow clearing support on city streets, where those services are required to facilitate the response of paramedic services, fire services, and Toronto Police Service vehicles and personnel. Yesterday, our emergency and essential services operated with an average unplanned absence rate of 13%. Between December 24th and January 17th, our emergency and essential services operated with an average unplanned absence rate of 12.3%. Our team continues to implement their mitigation plans effectively, thereby ensuring that these essential services continue to be delivered across the city. From a citywide perspective, yesterday, we operated with an average unplanned absence rate of 7.7% across all the city divisions. Yesterday, Toronto Paramedic Services operated with approximately 100 ambulances on the road and an unplanned absence rate of 17.7%. Also yesterday, Toronto Fire Services operated with 112 frontline trucks and crews in service and an unplanned absence rate of 14%. Yesterday's winter storm further challenged our on-duty staffing, and I thank everyone who extended their shifts and accepted overtime shifts, working together to mitigate yesterday's weather-related unplanned absences. Fire services are continuing to respond to approximately 60 additional low-priority paramedic calls each day, where there is no clear indication of a patient or injury. Each of our other emergency, essential, and critical services, including Toronto Police, Toronto Water, TTC, Shelter Support and Housing, Senior Services and Long-Term Care, Children's Services, and our city-operated COVID-19 vaccine clinics also continue to provide exceptional service to Toronto residents, and I thank them also. Many of these services were also impacted by the severe winter weather yesterday, including both TTC, who battled the winter weather throughout the day, and the city-operated vaccine clinics, which were forced to close yesterday as a result of the severe weather and road closures. Each of these teams continue to do an exceptional job of managing through the challenges associated with increased numbers of staff being unable to report for duty as a result of COVID-19. Our COVID-19 Strategic Command Team continues to work every day in order to ensure that all aspects of our citywide response to the pandemic remain responsive and effective. As the situation with COVID-19 continues to evolve, so will our planning and response. As always, I encourage you to continue to make toronto.ca/COVID-19 your first choice for up-to-date, accurate, and timely information on all aspects of COVID-19 response in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions. First, we'll go to Mark McAllister from City News. Go ahead, Mark.
Very much. A question for Mayor Tory to start. Obviously, there was many examples yesterday of people in the city helping each other out. I'm curious, what is the city doing for those who might find themselves stranded, either at home, not able to get out, or perhaps not being able to move their vehicle as a result of plows going throughout the city and plowing those vehicles into their space?
Well, I would say that to any person who finds themselves in that circumstance, and one of the things we would ask is for neighbors to have a look at people where they don't see them for a day or so, or where they just want to check in on them. That's a thing that Torontonians often do during these kinds of difficult periods following a storm. But from the city standpoint, of course, we are at the ready at 311, or in the case of an emergency situation at 911, to be responsive to people who find themselves in that situation. And, you know, the best thing we can do, I think, to make it possible for people who might find themselves in that circumstance is to proceed as we're doing with the first plowing operations and then the snow removal operations as quickly as we can, so that you'd have fewer people, obviously, finding themselves even possibly in that circumstance.
My follow-up to that is with regard to laneways. As you know, there are hundreds of kilometers of laneways in this city. Those aren't touched by plows. Those are city-owned laneways. What can be done to help people get in and out of those spaces?
I'm not sure if it's Vince that would be the best, Vince Ferrazzo, who, by the way, has done a superb job at sort of marshaling all the forces to deal with the plowing and the removal and all the things that go with this kind of a storm that might address the specific topic of laneways. And they're on the line, and maybe, Vince, if you could do that or designate somebody who might.
Yeah, Vince, can you go ahead, please?
Thank you, Mayor. Yes, so the city does maintain laneways throughout the winter. We first prioritize our expressways, major arterial roads, and local roads. But following that, we will begin attending to servicing the laneways. And we'll do so through a number of ways, by salting. But some of our equipment do have some blades or some plows that are attached to the front of the vehicle. So on those occasions, if the vehicle is able to navigate through the laneway, we'll be able to move the snow, but that will be the next road classification that we will be attending to after we hit all the roads and the sidewalks.
Can I just add, Mark, to something I said in my remarks and to what's implied, I think, by Vince's comments? There is a priority order in which this simply has to be done, and it makes sense. I think people understand it as much as they may wish that their own road or even their own arterial road or something closer to them, a laneway in their neighborhood, should get done first. There's a priority order in which this will get done, in which it is getting done, and that I would thank people for the patience they've shown so far and ask for their continued patience as we have all hands on deck. As you heard, hundreds of trucks, hundreds of plows, hundreds of people getting this job done as quickly as possible following a storm that's one of the biggest in recent history, and so it's going to be a bigger job to get it cleaned up.
All right, thank you. We'll go next to David Ryder from the Toronto Star. Dave, go ahead, please.
Hi, everybody. First question for whoever can answer it, and this is the first winter where a lot of people who live in the central part of the city are supposed to have their sidewalks cleared by city plows, as suburban residents have had for decades. Can you give me an update on that? Is it fully rolled out? Yesterday I saw lots of people out in the downtown area shoveling their own sidewalks with no plows in sight. Where are we at on that?
Can I start on that again, just by making sure the record is clear, because we were very straightforward and very clear, in part because of the availability of equipment, which was on order and hadn't yet been delivered and so on, in saying that this sidewalk clearing service in parts of Toronto that didn't have it before would be rolled out this year, but wouldn't necessarily be rolled out in time for the first snowstorm or the first month of the year. And so I did make that very clear, and so did other city officials at the time, that we confirmed the decision, which was a good one, to expand this citywide. And on that note, perhaps I'll ask if there's Vince or someone else wants to address the timetable as it presently exists.
Vince, please. Thank you.
Yes. So thank you, Mayor. Yes, so in December, we did receive our first order of machines. We did receive approximately 25 new sidewalk plows. And then in January, just a few weeks ago, we did receive a few more, 6 more. So we have approximately of about 35 machines that are being deployed. We did start them yesterday. And this is in addition to the 9 that we originally had when we conducted our pilot project. So as the mayor indicated, we put the delivery in. We were very fortunate that we were able to get some of the equipment delivered sooner than we had anticipated. And they are being deployed as we speak. They were out yesterday and they continue to be out today.
Okay. My follow-up, I think, is for Mayor Tory, and that's yesterday, while Premier Ford was out driving around talking to media and helping people, I guess, dig out of snowdrifts, rather. At Public Health, there was a fairly plaintive plea from Mr. Tanner, who I think is on the line now, talking about people overdosing in isolation hotels, and that the city desperately needs help from federal, but especially provincial partners in money to help have more medical personnel, more supervision in those sites. Mayor Tory, have you had any updates from Premier Ford? Is there any chance that we're going to see more help for that?
I haven't had a specific update from the province with respect to that help. I did happen to have a conversation, when I say happen to, I had a meeting this morning with Carolyn Bennett, who is the Minister of Mental Health and Addictions for the Government of Canada. And I'm certainly encouraged both by the fact that there was a commitment made during the recent election campaign to provide substantial additional resources in this area, and that I believe they're going to follow through with that in fairly short order, because I sense from my conversations with them there is a real recognition of the fact that this is a crisis. It was a crisis before now, in the sense that anytime you lose 500 people plus in the City of Toronto alone in the past year, that is indicative of something that requires more of our resources. But I have said repeatedly, and I've talked about this, as you know, and expressed grave concern about it directly to the Prime Minister, but also to the public. But I've said at the same time, this is part of the healthcare system. This is part of caring for people who have an illness or something that is affecting their lives in terms of a substance use issue. It is not a moral issue. It is not a legal issue. These are our fellow Torontonians who have these issues, and their families share those issues with them. And I think it is time for those additional resources to be deployed on an urgent basis. And as I say, I am encouraged by what I hear from the Government of Canada. I haven't had any recent indication of additional help forthcoming from the province, even though there is an agreement in place between those two governments to provide some additional funding, some of which has been supplied, but not in the quantity that's needed to deal with the magnitude of this problem.
Thank you. We'll go next to Francine Copen from the Toronto Star. Francine?
Yes, good morning. My question is for Vince. I'm wondering what the absence rate is in the transportation department, in the department that would be handling most of the snow clearing, and whether that's had an impact at all in the city's ability to clean up after this snowstorm.
Vince, please.
So the absence rate has not adversely affected our winter operations. Winter operations is an essential service, and our staff are dedicated and committed to providing that service. In addition, we have been working with our contractors throughout the year in putting together safety measures and protocols to prevent the spread or the outbreak of the Omicron variant. So I'm very happy to say that, in fact, the COVID situation has not in any way adversely affected the attendance of our staff for winter operations.
Thank you. And at this point, how far percentage-wise are we into the snow cleanup effort? Has the majority of it been done? Are we halfway through? Are we almost at the end of it? How much longer do you need to sort of make sure that everything's cleared away?
I don't know if I want to give an exact percentage. We will be operating throughout the entire week. So today we are continuing with our plowing operations, and that will likely continue tomorrow. As a result of the declaration of a major snow event, we will also be executing snow removal and cleanup, and that will likely take us throughout to the end of the week. So we're still in the early stages, but we will be continuing throughout the week.
Thank you, Vince. We'll go next to Ben Spur, also from the Toronto Star. Ben, go ahead, please.
Hi there. This is, I think, a question for someone in the transportation department, but also I would be interested to get the mayor's thought on this. Admittedly, a more lighthearted question here, but I think one that's on the mind of many residents this morning. But as people are digging out of the snow, there seems to be a debate about on-street residential parking spots. Some car owners seem to think that if they shovel out a parking space in front of their house, then they are entitled to that spot. They kind of have dibs. Others argue that once a spot is cleared, that space is fair game for any driver, no matter who shoveled it. So in the city's opinion, who's correct here? Who gets dibs on a freshly shoveled spot?
Let me go to Barbara or Vince. Barbara, can you take that one?
Sure. Hi, Ben. Thanks, Brad. The city's on-street parking resource is a resource that's for everyone, and I know this happens sort of North America-wide, that people go in and put in the effort to shovel, but those spaces are there then open to anybody who may use them on that street, as long as they have a valid permit, of course. But I know it is frustrating for people who spend that time to dig out if somebody else were to come in their place, but the city does not have a formal process related to that.
Mr. Mayor?
Yeah, I just add, the Toronto way of doing things says 100 times out of 100 that you work out a cooperative arrangement with your neighbors, perhaps to, shovel more spaces and make them available on a basis where we cooperate with each other as opposed to, some kind of competition. I can just see, car derbies that could go on if you had that sort of thing happening. And that's not healthy, it's not safe, and it's not the way we do things. So I just hope people can work this out as our wonderful public works and contracted crews actually plow the snow and help to clear things up, that people can cooperate on this and not have any kinds of disputes about this kind of thing.
Do you have a follow-up, Ben?
Yes, I think just following up on what Barbara said, should I take it that, some people might be trying to block off or kind of occupy spots that they shovel with chairs or garbage bins or something like that? It's fair to say that that is not allowed under the city's rules. That's not something that residents should be doing once they shovel a spot.
That's correct, Ben. I haven't heard any incidences of that, but certainly I would echo exactly what the mayor said, just about people doing a little bit more than their part and not resorting to trying to block off spaces in the city's right of way, because certainly the safety of our plow operations is number one, and we absolutely need to do everything that we can as we are to get the city back to a condition where we have the snow gone and taken care of and sorted out. So it's really going to be, we're going to really need to rely on people to make sure that they're trying to keep those rights of way clear.
All right, thank you. And our last question is from Miriam Edahaya from Radio Canada. Miriam, go ahead, please.
Hello, my first question is for Chief Pegg. Did first responders such as paramedics have a hard time getting to people in need of assistance because of the snowstorm yesterday?
Hi, Miriam. So to say the least, yes, the weather event yesterday created challenges across the city for everyone, and certainly that included our emergency services. But I can tell you that all of our emergency services, including paramedics, Toronto Fire and Toronto Police, worked hand in hand and alongside one another. I had some fantastic video and footage sent to me throughout the day yesterday of those teams working together and residents coming out to make sure that ambulances could pass the road along with fire trucks and police cars. And I'm not aware of any substantial challenges. Brad, we may have Chief Raftis on the line.
Yes. Chief Raftis, if you're able to add to that, please.
Yes, thanks very much, Matt. Yeah, yesterday was truly an exceptional event, and it was challenging to get around the city and get to calls. But as Chief Pegg had identified, the City of Toronto's emergency services family, we really have best-in-class contingency plans working very closely together. I was so heartened to see, along with our emergency services colleagues, pushing ambulances through snow drifts, also the public getting involved in helping out. So very busy day yesterday, over 800 emergency calls responded to. We continue to work through the event today, and we'll continue to work very closely with our emergency services colleagues. Back over to you, Brad.
Mayor Tory?
I only want to say, if you have a city where you have people helping to push ambulances, push buses, I saw instances of people pushing police cars, helping each other, shoveling each other's walks and so forth. Surely this couldn't be the same city where anybody would consider shoveling themselves a parking spot and blocking it off and causing some kind of a confrontation in their neighborhood. So I think it just really underlines that the spirit of how people approached this yesterday, and I'm sure again today, goes against that sort of thing, and I'm sure it won't happen across the city.
Follow-up, Miriam?
Yes, if I may, Mayor Tory, how long before, the streets are clear and things get back to normal in the city, including transportation services? Can you just give us the big picture here?
Well, I'll see if Vince wants to add to this, but I think we're always very careful, not to put a precise timetable on it, because obviously there's a lot of work to be done, and there's every resource possible, hundreds of snowplows, hundreds of trucks being applied to this. But as has been pointed out, you have to do the plowing first and then begin the snow removal, and it is something that is going to take time. This is a storm that ranks among the biggest in recent history in the city, and so it's going to take I think anybody who's tried to shovel their own walk will understand the magnitude of this relative to normal circumstances. And so the answer is as quickly as possible. And that is what I know every part of this team, led by Vince Ferrazza and his group, and by Barbara Gray, that's exactly what they're trying to achieve. And I know that's what they will do, is get this done as soon as possible so that the city life can get back to normal and people can be safe. Most importantly, safe from everything involved with winter.
Vince, maybe you could just lay out the next 72 hours just at a high level for us, please?
Certainly. So as the mayor indicated, we are continuing with our plowing operations, and that will continue straight until tomorrow, Wednesday. Following that, it's a cleanup effort that will involve the actual removing of snow, where snow is actually collected and transported off of the road allowance. And that will take a few days in of itself. So as the mayor said, it's going to take some time. We're moving as quickly as possible, but over the next 2 to 3 days, we're looking at continuing plowing and removal and cleanup.
All right, thank you, Vince. Thank you, staff on the call. Thank you, Mayor Tory, Dr. Davila, Chief Pegg, and thank you all for joining us. That concludes today's briefing. Please stay well.